Agoraphobia and neuronal linkage outcome. Most people think agoraphobia means fear of open spaces, but it is much deeper than that. In agoraphobia, the brain starts treating normal places like crowds, markets, buses, bridges, or being outside alone as dangerous. The amygdala activates the fear alarm, the hypothalamus triggers the sympathetic nervous system, and the body respond with panic symptoms like fast heartbeat, sweating, dizziness, shortness of breath, and fear of losing control, just like fight and flight symptoms. The hippocampus stores that place as a fear memory, while weak prefrontal cortex uh, control fail to calm the response. This is how fear becomes avoidance, and avoidance becomes a cycle. Hi, my name is Dr. Vas, and today we're going to discuss agoraphobia and neuronal linkage. Fear situation causes macula alarm and autonomic panic gets started, which leads to avoidance learning. The core concept agoraphobia is an anxiety disorder involving fear situation. Neuronal linkage involves overactivation of fear circuits, panic-like autonomic system, fear memory formation, and reinforcement of avoidance behavior. Typical fear situation include public transport, crowds, open spaces, buses, enclosed places, queues, and being outside home alone. That is the disease overview. Mark fear or anxiety about situation where escape may be difficult. Fear often centers on panic-like symptoms, embarrassment, faintness, loss of control, or inability to reach safety. Common avoided situation, public transport, open spaces, crowds, being outside the home alone. Why it becomes disabling? Avoidance produces short-term relief. The brain learns that avoidance prevents danger and fear. Daily functioning, work, education, travel, family, and social life become restricted. Severe cases can lead to being housebound and dependent on others. Mechanism trigger situation, threat appraisal, amygdala activation that causes the activation of hypothalamus, blood brainstem, panic-like symptoms or panic disorders, escape avoidance, panic sensations, palpitations, sweating, trembling, dizziness, shortness of breath, chest tightness. Learning loop may include person escapes the place, anxiety temporarily drops, brain learns escape kept me safe, awareness becomes stronger. Maintenance factors, catastrophic thought, body sensation monitoring, safety behavior, avoidance, and comorbid panic. Neural linkage involves circuit rules, amygdala, hippocampus, hypothalamus, brainstem, insula, and prefrontal cortex. That is the mechanism how different parts of the brain get involved in this situation. Neurochemical links, GABA decreases, increase in noradrenaline, just like fight and flight, altered thought or altered threat, resilience, fear conditioning, and avoidance learning. The pathology, fear circuit hyperactivity, amygdala alarm activate despite low objective change. Interoceptive fear, normal body sensation are interpreted as dangerous. weak to down control. Reduced cognitive control allows fear response to persist. Catastrophic thinking maintain anxiety. Avoidance pathology relief enforces avoidance behavior. Fear generalized to more locations. Functional impairment increases. Clinical representation and diagnosis. Clinical features like agoraphobic situations are avoided. Physical symptoms may be resemble panic attacks. Symptoms are disproportionate to real danger. Assess common panic disorders, depression, substance use, and medical mimics. Medical rule outs, hypothyroidism, cardiac arrhythmias, vestibular disorder, hypoglycemia, substance, caffeine, stimulants affect medication adverse effect, especially respiratory disease. Treatment overview, psychotherapy, exposure therapy gradually faces fear situation, cognitive restructuring, interoceptive exposure, and safety behavior. Medication, SSRI and SNRI uh, are the commonly used drugs to treat agoraphobia. Uh, Examples: sertraline, fluoxetine, citalopram, and venlafaxine. When you provided these drugs to the patient, monitored response, adverse effects, and comorbid depression. Supportive strategies, psychoeducation, breathing and grounding skill, sleep and caffeine management, family support, relapse prevention plan, and virtual exposure may support therapy. How exposure therapy rewrites the fear circuit? Fear plays, stay safely without escape, anxiety rises then falls, brain learns I can cope, avoidance reduces. Gradual exposure, uh, you have to create the hierarchy. Start with manageable situation, repeat until confidence improve, increase difficulty gradually. Mechanism, extinction learning, reduce amygdala alarm, uh, stronger prefrontal cortex control, and new safety memory formation. Results in less avoidance, improved travel and independence, reduce panic fear. Prognosis, good prognostic factors, early diagnosis, willingness to practice exposure tasks, family support, treatment, and persistent follow-up from the psychiatry and other physicians. Challenges, long duration without treatment, severe avoidance, comorbid depression, and limited access to CBT exposure therapy. Mechanism summary, placed feel unsafe, amygdala alarm, hypothalamic activation, sympathetic symptoms like the patient having fight and flight, catastrophic interpretations which leads to escape or avoidance, short-term relief, avoidance reinforced, fear generalizes, and functional impairment. That is the uh, core conclusion. Agoraphobia persists when fear circuit and avoidance learning repeatedly teach the brain that feared places are dangerous and escape is necessary. Thanks and regards. Please like and subscribe this channel for further discussion on different diseases. Thanks.